Nayanthara Rai reporting for ET Now. So the Prime Minister Narendra Modi is all set to launch the National Digital Health Mission, NDHM. What is it all about? Well, we at ET Now have got a sneak peek and exclusive access to how all of this is going to work. So on the occasion of Independence Day is when it's supposed to go live. So basically this is how it's going to work. First of all, it's completely voluntary, whether you are a doctor or whether you are a patient. So that's one of the most important things you must keep in mind. So I'll begin with people like you and me, not healthcare providers. So we have an option to get a digital health ID. You can get it yourself with self-registration on the mobile phone or on the website, or you can take the help of a doctor or a hospital as well. It's a 14-digit number. Your ID will be whatever username you choose at the rate of NDHM. So that's your ID. Your health ID will have a photograph, it's going to have a QR code, and to generate it, you need to give your name, your gender, your date of year, and either your mobile number or your Aadhaar number. So Aadhaar is not mandatory. I know a lot of people don't like to share information, so I'm saying that right up front. You don't have to give your Aadhaar number, but you will have to if you want to use any government schemes, insurance schemes of the government. Then they will require the Aadhaar number. What's also interesting is that you can have and you can generate multiple health IDs. They advise against it, but it's up to you. So that's as far as your health ID goes. Okay, and it's going to have a photograph also, obviously. Then the doctors. I told you, remember that they can also volunteer to be what they call digi doctors. Digital doctors. It's up to the doctors to decide if they want to volunteer and be part of the digital ecosystem. Why they should? Because if they don't, they can't give e-prescriptions, do e-diagnosis, give checkout summaries on the online format. So that's the advantage for them. If they want to be relevant and part of the digital ecosystem, they're going to have to be. But I think this itself is going to be massive. And here's why. For the first time ever, you're going to see an initiative to actually create a database of doctors. And more importantly, this repository will obviously only have qualified doctors. I don't know about you, but I'm sure it's for you as well. I'm sure it's happened to you, or you know someone, or someone in your family has gone through it, or some friend has gone through it, some neighbor, someone, where they've gone to people trusting them to be doctors, and they're not doctors. Pardon me for saying this, they're quacks. It's the first time you're going to have a repository of doctors, and the information will start flowing in from medical colleges. And the repository will only have those who are, also identified by a state medical by the State Medical Council or the National Medical Council. So this is really crucial. For the first time, you're going to have this database and this repository that's going to be available. Third, the healthcare providers, the hospital chains, your clinics, the facilities. They will also have the information, right? So what's going to be interesting is they will have to maintain this data physically in a server in their own, facility, I guess, to make them accountable for it. So that takes care of the whole chain, right? You've got the people, patients, the people who need the healthcare, who are going to provide it, the doctors, and where they're going to provide it. You also register and have a database then of hospitals, clinics, centers, the whole rigmarole. Now, I told you it was, everything voluntary, but it's also going to work by consent. So you will always have your data, and it's up to you who you want to share it with. So why is this crucial? Supposing, let's take my case. I'm Nayanthara Rai. I go to a clinic in Gurgaon. I'm diagnosed with something. And, I've got the digital health ID and all of that. So my patient history is on that ID. I then want to get a second opinion, and hypothetically, let's say I go to AIMS in Delhi. What happens? How is that information going to be shared if I've opted for this digital route, right? So it can be shared. Your medical records in the electronic form are your information. The center will have it wherever you got it made and wherever you went, but it cannot be shared without your consent. And once it's made, by the way, it cannot be edited. So you can't say that, acha, ye hata do, insurance company ko na pata lage, none of that happening. It can't be edited once it's there. Like, you can give notes on it. So I'll have to give instructions that please share this health information with AIMS. I have to give my consent to it. Then my doctor in AIMS will be able to access my medical records in a PDF format, in a read-only format. So he can't or she can't change the medical records that have been created for me in the Gurgaon hospital. Now, what all can be in your e-medical records? Prescriptions, diagnostics, radiology reports, lab reports. So all of that is going to be included. So this is a game changer coming, ladies and gentlemen.